Welcome to the Explainer. Today, we're going to peel back the curtain on something that seems pretty simple, a thoracic spine x-ray, for your upper back. But it turns out getting that perfect picture is this incredible mix of physics, anatomy, and some real clever problem solving.
I mean, think about it. The thoracic spine is one of the hardest parts of the body to get a clear image of. It's like, imagine trying to take a perfect, clear photo of just one building, but it's smack in the middle of a crowded, moving city. That's the challenge we're talking about. So how in the world do they pull it off? Well, in this explainer, we're going to walk through the radiologic technologist's playbook, from the standard stuff to the really creative tricks they have up their sleeve to get that perfect shot.
All right, first things first, let's really get our heads around the problem. Why is this one part of the spine so ridiculously hard to capture on film?
It's really all about location, location, location. The very things that keep you alive, your ribs, your lungs, your heart, they all get in the way of the x-ray. The ribs literally form a cage around the spine, the lungs are full of air and vessels, and the heart is just another dense object in the path. So getting a clean look at those 12 vertebrae means you have to outsmart all that anatomy. So let's get into our first and most basic view. We'll see how technologists get a baseline image from the front. This is called the anteroposterior, or AP, projection. And just look at how precise this is. Every single one of these steps is designed to take out any guesswork and line up the spine perfectly. You have to balance your weight so the spine doesn't twist even a little bit, and get your shoulders perfectly level. The X-ray beam itself gets centered right on the 7th thoracic vertebra, T7, so you get everything in the frame. Now, this is where some super clever physics comes into play. You see, X-ray tubes aren't perfectly even. They're a little stronger on one side. Technologists actually use this quirk called the anode heel effect on purpose. They aim the stronger part of the beam at the thicker lower part of your spine and the weaker part at the thinner upper part. The result? A beautifully balanced picture. It's brilliant. And here's another great little trick. They'll ask the patient to breathe all the way out and hold it. Why? Well, when you do that, your lungs deflate and the whole chest area becomes more uniform in density. This stops the spine from getting washed out in the picture. It makes the bones just pop with sharp contrast. And this is what they're looking for in the end, a perfect front-on view. You've got to see all 12 vertebrae, you need the landmarks at the top and bottom, and you check for any rotation by making sure those little bumps on the spine, the spinous processes, are lined up perfectly down the middle. Okay, so the front view is down, but what happens when you need to see the spine from the side? Now you have to shoot the X-ray right through that whole mess of ribs and lungs. How is that even possible? Well, this is just fantastic. There are two totally different and, frankly, genius solutions for dealing with the lungs and ribs. The first is what we've already seen. Hold your breath out for a super sharp, still image. But the second one is totally counterintuitive. They have you breathe normally, but for a really long exposure, like 3 to 5 seconds. All that breathing movement actually blurs the ribs and lungs into the background, making the spine, which is staying still, stand right out. So a great side view shows the vertebrae clearly right through the chest, with nice open spaces between them. But, and this is a big but, notice that last point. This view has a known blind spot. The patient's shoulders are so dense that they almost always block out the top 3 vertebrae. And that blind spot? Well, that's what leads us to one of the most creative and perfectly named solutions in all of medical imaging. So how do you see through someone's shoulders? Simple. You don't. You just have to get them out of the way. And to do that, you have the patient strike a very particular pose. This is just pure anatomical genius. You have them raise one arm up and drop the other one down and back, kind of like a swimmer doing the freestyle. This motion separates the two shoulders just enough to open up this perfect little window for the X-ray beam to shoot right through, finally giving a clear view of those hard-to-see T1, T2, and T3 vertebrae. Okay, we've seen the front, we've seen the side, but what if the doctor needs a good look at those tiny little joints that connect each vertebra together? For that, a straight-on shot just won't work. You need to get an angle. These little guys are called the zygapophyseal joints, or just Z joints for short. They're absolutely essential for letting your spine bend and twist. But because of how they're shaped and angled, the standard front and side X-rays just don't show them clearly. So seeing them is the entire point of this next set of views. And it all comes down to this one magic number, 20 degrees. A 20-degree turn from a perfect side view is the exact angle you need to get those joints to open up perfectly for the X-ray. Not 15 degrees, not 25, 20. It's this tiny, precise turn that tells a whole different anatomical story. And this table basically shows you how that 20-degree turn is put to work. Depending on which way the patient is facing and which way they turn, the technologist can choose to highlight either the joints that are closest to the detector or the ones that are farthest away. It gives them an incredible amount of control to target exactly what they need to see. So after all of these different views, all these positions and breathing techniques, what's the big takeaway? What does it all really mean?
The main thing to remember is that what looks like a simple black and white picture is, well, it's anything but. Every single image is a result of incredible skill. Every position, every breathing instruction, every specific angle, it's a calculated, elegant solution to a really complex visual puzzle that our own bodies create. In the end, this whole process kind of reveals a deeper truth, not just in medicine, but in all of science. Behind so many things we think of as routine, there's this amazing depth of expertise and creativity. It really makes you wonder, doesn't it? What other simple things are hiding this level of elegance and complexity just beneath the surface?